Glad you been able to join us today. My name is Fred Brown. Like I said, this is our second session, a follow-up to our first session last week. If you weren't able to make the previous session, be sure to revisit the recording. There will be some folks who will see this recording as well. But we have a ton of content today to cover, a ton of information that it's my pleasure to share with you that hopefully you'll be able to utilize, put into practice, whether personally or have information and resources to share with others, your loved ones, and so forth. Also, we'll get you connected to additional resources so that way you can continue your journey into preventing your health and also significantly improving your health, if you so choose to apply the information. Once again, I'm not a medical doctor. I am a respiratory therapist, but more importantly, a Buteyko specialist. And that will be the center and focus of our conversation today. Understanding how to, number one, apply some basic principles in Buteyko, why it's important, and as well, how can that impact what we're dealing with in our times presently, and that's COVID-19. How can that relate? How can that help or prevent us from succumbing to some of the difficulties that COVID-19 presents, as well as if you are sick with COVID-19 or any virus, bacteria, some things that you can do to help to promote your own health or the health of your loved ones. Without further ado, let's jump right into the information, right into some of the topics that we highlighted. And that is, one, our expectation with these courses. Many of us may have come and purchased this course with various expectations, but I like to give you maybe a sense of reality. And that is, this course is not designed to really replace the full education that we do provide, that we'll be talking about later, particularly level 1 training. And so it's not, I can't replace that, but we want to give some key foundational tips. So almost like I think of it like an appetizer. You're not getting the full meal for time's sake, because I can't condense a 8-week course into 2 sessions. But we want to kind of pack these sessions out as much as possible, as much value. And so think of it as an appetizer. Think of it as an appetizer can satisfy your hunger, but it's not designed to give you the full meal. But let's dive into some practical tips, which I'm sure many of us are here for. And in my training, I like to really separate these tips into 2 categories. One is specific actions that you guys can take, and also lifestyle changes. We find those are 2 key principles that, if you harmonize together, will have a synergistic effect. Things that you can specifically do, whether it be breathing exercises, and then also lifestyle changes. And so we'll talk about that, because they do impact and enhance one another. One of the tips we talked about last week was about proning. And that's a term that we use in the hospital, where when patients have difficulty breathing, especially with this COVID-19, we talked about last week, and these are things that we do to help prevent patients from going on ventilators if their oxygen level is low. We have them lay on their stomach, lay on their chest. And that's something that you can do, and from a Dr. Buteyko's perspective, is it helps to decrease breathing in this position, right? And I've literally seen, as I said, shared last week, where an individual was on 100% oxygen, and they were ready to get more advanced therapy because their oxygen was still low. And by just flipping the person and them laying on their chest, I particularly have my patients go to the top of the bed, so that way their head is a little bit at the top of the hospital bed, and placing a slight pillow, on the side, so that way they have a little bit more room, and their neck is not so much cocked to the side where it could be uncomfortable, but they can lay on a little pillow or the edge of the pillow, so that way your head is more at a diagonal, and that way it's, in that position, it can be a little bit more comfortable, and they can, one, relax, rest, and also help the weight of their own body minimize their breathing. That's something, as I said, all these tips you'll see can be in some shape, way utilized at home as well as in the hospital. So if you find yourself in the hospital and with feeling a shortness of breath, this is not something that you have to wait for your doctor to order. This is something that you can just utilize and apply yourself and gain those benefits to kind of prevent from your health decreasing. And so that's one principle. And we talked about that last week, and that's like a specific action that you can take. Another, I would say, lifestyle change, and that is what we call, oftentimes our lifestyle promotes a level of stress and anxiety. Particularly, many of us may be latched on to watching the news or engaging in activity using social media. And you got to realize this can have an impact on your health. This can have an impact, as we all know, on your anxiety. And anxiety, stress, all are key components to ill health. And so really learning how to minimize the exposure to these unhealthy activities, mentally, physically, as well as creating anxiety. It's good to be plugged in with a little information, but the overstimulation will have a negative impact on your health. And so because media, social media, some people do gaming, watch movies. All these are stimulation, and unfortunately, we live in a society where it's normal, but it's an overstimulation, and it produces a lot of what's called dopamine, which is a hormone that makes you feel good, and why we can become addicted to news and media and things, where one of the lifestyle changes is what we call a dopamine detox. And I'll put in the chat box a reference to a video that will help you understand a little bit better about how you can have a dopamine detox and help you to decrease your anxiety. Let me put that right in the chat box so everyone can have access to it. The principles that we teach. Stress, we all know how stress is negative to our health, but we may not know how negative it is to our breathing. And stress and hyperventilation, breathing too much, go hand in hand. And why is this? I know we have many people here from different backgrounds. Some are familiar with Buteyko, some are not. So I'll try to, kind of cater to both audiences. But let me take, a step back and just sharing a little basic foundation so that those who are familiar can be reacquainted, or the key to learning is repetition. But those who are new can also kind of grasp, why are the things that we're talking about? Why are these practical tips? Why are they important? and how does it relate to improving our health? Well, one of the key principles in the Buteyko method is relax, decreasing our breathing and increasing the level of CO2 in your lungs. Why is that? Well, Dr. Buteyko, he didn't discover this, but he was aware of this, and that was a principle known as the Bohr effect. And for many of us, some people are facts checkers, which is fine. And but this is something that you can look up on the internet, and I will put this also in the chat box. Christian Bohr was a physiologist, and he made people aware of this concept, the Bohr effect. And so it's in the chat box. So you're welcome to look this up, the Bohr effect. And Dr. Buteyko, he didn't discover it, but he utilized these principles, the principle of the Bohr effect, to really significantly impact people's health. And in a nutshell, it pretty much speaks about how we all know how important oxygen is. I mean, that's the center of the focus of, when you go to the hospital, they're always concerned about your oxygen level, your saturation level. Many of you may have pulse oximeters, that either you use in the hospital or you use at home, right, to check the level of oxygen. Well, we all know the importance of oxygen. It's to be consumed and to get into our cells. That's the whole purpose of, our breathing system. But what we may not know is the connection between oxygen and CO2, how both are important. And this is what the Bohr effect addresses. But the proof is in the pudding when you apply these principles over a period of time and you start to notice the effects. It can have a significant impact on your overall belief system. And that's what it did for me. As I said, I've been a respiratory therapist. Last week I shared with you, I've been a respiratory therapist for about 25 years. And even though when I was getting my training, a lot of the information was counterintuitive initially, it made a lot of sense. And when I started to apply it to myself and to my patients, I saw a significant impact. I'll share one with you. Recently, there was a gentleman who was COVID-19 positive. He was making some progress, but he still was needing a certain level of oxygen. And as his oxygen level was decreasing, I shared it with him. I said, and this is another principle that you can apply to yourselves, but I'll share with you how it impacts this person. I shared with him, it's important that you, one, breathe through your nose and focus on relaxation, decreasing your breathing, because he had a lot of noisy breathing at the time because he felt a little shortness of breath. But I assured him, I said, it may sound counterintuitive, but if you do this, you're gonna feel better. Well, lo and behold, he did apply it. When I went to see him again, I asked him, how's he doing? Are you doing the nasal breathing? Are you doing the relaxed breathing, decreasing your breathing from noisy breathing to light breathing? He said, I felt, an hour or two, I went back to visit him. Said, yes, I feel much better, and my breathing is much more comfortable, and you can see in his face that he was much calmer, much more relaxed, because noisy breathing also promotes anxiety and stress. And anxiety and stress also causes noisy breathing. And once again, what I mean by noisy breathing is, rapid, deep breathing, So it's a vicious cycle that many of us may not realize how we have significant control much more control over our breathing than we think. And so just by me giving him this instruction, he was able to relax his breathing and feel much better and actually be prepared to get discharged out of the ICU. So if these principles are able to work on the sickest of the individuals who are positive, think of the capability of those who are not at that stage. And so it's going to be that much more powerful and that much easier for you to apply. So that's a key principle. Because one of the things that whenever I bring up the topic with folks about breathing, they typically may have the false assumption that, yeah, I know how to breathe healthily. Yes, deep. They always say in through your nose and out through your mouth. And from this Dr. Buteyko's perspective, that would be incorrect. It should be in through the nose and out through the nose, not in and out through the mouth. You will typically hear that consistently, but I'm sharing with you, try it, you'll like it, you'll notice a difference. You want to lower the amount of your breathing, and when you breathe out of your mouth, you're able to breathe a lot more volume than you should. When you breathe through your nose, just think about it. The diameter of your nose in comparison to your mouth is significantly less. So when you breathe out, it supports the light, soft concept of breathing as far as volume. We want to not blow off too much CO2 in our lungs, because we spoke about it earlier, because of the Bohr effect. We want to make sure that in our body it has a reservoir of CO2 to draw from, so that way we can actually maximize and increase the uptake of oxygen in your lung, throughout the cells in your entire body. And by doing that, how does that impact our health? It helps every system in your body become more efficient. And that's why CO2 was considered not a waste gas, but from Dr. Buteyko's perspective, the main regulator for every system in your body, because it can increase the uptake of oxygen in every cell. So because our organs consist of cells, if you have a more increased uptake of oxygen, and if that system is working more efficiently, therefore that's how it's going to impact your overall health. Whether you're talking about your immune system, whether you're talking about your cardiac system, whether you're talking about mental clarity. So it goes beyond just our lungs and the improvement of our lungs, and having the right amount of oxygen. Really, it goes beyond that, and really overall helping to improve every system and making your system more efficient, including your immune system, so that way you can have an improved defense mechanism against COVID-19 from a prevention standpoint. So you can have, if you do have COVID-19, you can maximize and improve your health as you battle through those symptoms, and quicken your recovery time. We want to talk about another practical principle, a specific action, and that is wearing your mask. People are focused on wearing their masks. My focus is using your mask for a different purpose. If you do wear a mask, you can use it as your Buteyko exercise, because once again, it's going to help decrease your breathing. But the important thing is breathing through your nose underneath your mask. Now, it will promote, maybe it'd be initially a little uncomfortable because you're not used to it. But once again, it's an exercise. It's a simple way where, hey, if you have to wear your mask or choose to wear your mask, that's one way where you can allow it to and help to now use it as an exercise to improve your health, to help you focus on, one, your breathing, so that way you have a greater awareness, and two, help you to practice nasal breathing, even though it may be a little bit more difficult. So that way when you're not wearing your mask, it's that much easier to breathe through your nose, so forth, and along those lines. Now, sometimes people may say, well, I have a deviated septum, or I have other issues. Well, from this perspective, it's really the reverse. From Dr. Buteyko's perspective, your deviated septum, your congestion is as a result of not nasal breathing, consistently mouth breathing. That's actually your body's defense mechanism of trying to decrease your own breathing. And so when you start to reverse, and maybe initially, for depending on where you are in your health journey, it may be more difficult than others. But if you start, you can start to decrease those symptoms, even if those symptoms are a deviated septum. Just work with your body, and you may not be able to do it for a significant length of time initially, but just work with your body, practice these principles, so that way, as they say, if you don't use it, you lose it. Well, because you haven't been using your nose, your breathing properly, we have these symptoms. But when you start to use it, either shorter initially, if need be, and then increase the amount of time, then that would be a way to kind of turn the table, and allow things to adjust and change. These are just continuing on some other things practical things that you can do, and that is start, as you're doing your dopamine detox, well, that provides you opportunities and time for now taking a walk, engaging in some low level of activity, because that's another key principle of increasing one's CO2. Helping to decrease your symptoms. I'll share another example in the hospital where there was a young woman who I was seeing in the hospital, and she had a significant cough. She was constantly coughing. Now you would say, Fred, I can't do this breathing stuff, with a chronic cough, and maybe some of you, have a chronic cough. Well, what I shared with her is first start, as I'm sharing even in this session, start with doing something than nothing. And I asked her to start slowing her breathing down, focused on nasal breathing. I asked her to focus on relaxed breathing. And within 20 minutes, I went back to visit her in her hospital room, and she was no longer coughing. So by her making these adjustments, she had a chronic cough, which is a symptom from Dr. Buteyko's perspective of your body trying to decrease your breathing in an alternative way because the individual is not. But then once you start decreasing your breathing, you notice that those symptoms will dissipate because your body doesn't have to resort to those alternative ways of trying to decrease your breathing. That is really the perspective from this method that really is a different way of looking at health and improving our health. Dr. Buteyko pretty much really was bringing to our world a different way of approaching health and addressing our health, a really new health concept. And so the results kind of speak for themselves. Moving on, trying to make this, utilizing our time most effectively, I'll continue and share some other principles that one can do also that can help with coughing or any related symptom that one can do in the hospital or at home. And that's what we call short breath holds. And a breath hold is basically just breathing, as we mentioned before, practicing, LSD, right? Light, soft, deep breathing, but just breathing in, and then when you breathe out, you take and you hold your nose. Trying to relax, and I would say hold it for maybe 2-3 seconds. if it's difficult, because your health may be to a point where even 2-3 seconds is difficult. Well, that's okay. Do what you can. Just hold it for 1 second as an exercise, and do that consecutively. Hold it, and then maybe wait for a few minutes, a minute or two, 30 seconds, and do it again. And that's an exercise that you can do for, say, an hour. Do that alternating, holding for 2 to 3 seconds and relaxing, holding for 2 to 3 seconds and relaxing for a short period. If you're familiar with Buteyko, or a little bit more, your health may warrant, you may be able to hold it longer. That's fine. But I would say start doing short breath holds. And it's something, when you do a breath hold, you've done it too long, when after you release, you want to take a deep breath in, right? That means you've pushed your breathing too much. When we talk about changing our breathing pattern, everything should be done from a gentle perspective. It kind of like hits on the subject of what makes the breathing center a little bit different. And that is, one of the key principles is that may be different than maybe some of you have experienced other methods that have been taught, was you have to push your breathing. You have to have a strong response in breath holding. And that's not something that we teach here. Unfortunately, and I'll just touch base on this topic real brief, but unfortunately, the name Buteyko in this country was not, unfortunately, it was not protected. And so pretty much anyone can take that name, develop a website, or even if they may have gotten some training from Dr. Buteyko himself, but they not have been fully trained. And they're able to take that information, whether even someone today can just go create a website, slap the name Buteyko on it, and call themselves a Buteyko instructor. And this is why not all Buteyko methods are the same, and why people get varied results. Some people may still have been familiar with, or feel they're familiar with Buteyko, but they're not getting the results that they're looking for, that we even speak about. Well, that could be a reason why, is because they weren't trained or by an individual who was fully certified. And they may have combined principles from Dr. Buteyko, but combined it with other information that they've had and packaged it and labeled it as Buteyko. But that's not the same. All Buteyko, just be aware, is not the same. And so that's why I would encourage folks to stick with the original lineage, and that's with the breathing center, because in Russia, where it was originated from, they do have a patent on the name. There is more control, and that's where the advanced practitioners and founders of the breathing center have received and continue to receive their training and their support. And so there is a big difference, and that's why some people, even in our session, may be aware of why they have gotten different results. So just to share that, keep a little piece of that to really consider and provide you as some guidance. And the question is, who should you rely on? How do you know? Once again, you will know. That's why I say, as far as guidance, sticking with the breathing center, and on the breathing center, they have a list of certified Buteyko practitioners. And so use that as a resource for your own research. So not talking is another principle, especially when you're sick. especially when you're having symptoms. I'll give you an example that will kind of demonstrate the power of not only the Buteyko method, but also combining it with not talking. You know, we're so used to being on our cell phones, you know, and people calling us, and maybe we you know, in the hospital even, you know, they're calling us and speaking with us. I recall there was a young lady who, she was an athlete, but she had significant problems with her asthma. She was in the ICU. She was wheezing, breathless, on oxygen, you know, requiring, you know, nebulizer treatments. And so once again, I learned this method to try to help my patients. And so what I do in the hospital is I try to, you know, fashion it in a way that, you know, in a way that, one, they can comprehend and utilize right then and there. So I noticed too that this young lady was also, even though she was breathless, on the phone. And so I shared with her, I'd like you just to try this. It may be something different that you haven't tried before, but focus on breathing through your nose, relax your breathing, you know, LSD, and take a break from the phone. Just do me a favor just for this period of time. And like I said, ICU, she was in intensive care. She was there because she had significant symptoms. Well, by the end of my shift, and this is not normally the case when you have a person who's in what's called static asthmaticus, you know, significant wheezing. Usually they're there for a day or so being managed. But by the end of the shift, she was being discharged out of the unit. Why? Because her breathing was much more controlled, and she did what I asked her to do. She did follow. She stopped speaking on her phone. She focused on nasal breathing. I didn't increase her medication, like oftentimes, yeah, frequency of giving her nebulizer treatment. I asked her just to focus on some basic principles that Dr. Buteyko taught. And like I said, before the shift was over, she was so well that she had gotten discharged and sent to a regular floor. So once again, these are just sharing these examples with you just to help you to wrap your brain around how powerful your breathing can be, especially if you start taking more control over it and applying these principles. We have a lot more control over our health, and as a result of having more control over our breathing than we expect, than we can anticipate. But when you do these things and you see the results, it will change your belief system. It will change your approach, you know. And so this is why, one, we're having this session. This is why we want to bring this information to the community and open it up to some questions for the rest of our time here and possible answers. I may not have all the answers that you're looking for. I may have some of the answers. So as being transparent, I'll do my best. But I do have some, you know, experience utilizing these principles in the hospital as well as out. And so, Barbara, I see, just raise your hand if you like to, in the chat box.
Hi, I do.
Vive?
Yeah,
Yes.
you remembered. Thank you.
Hey, Vive. Hi, how you doing? Thanks for
Doing
joining us again.
Thank you so much for having this. Verbally, how, if ourselves, we may not be in a position to do it, but more if a loved one goes to the hospital and we
Yes.
actually speak to someone. We are
right.
capable of getting to someone, which I know is hard as well because everyone's so slammed. When we want to talk to them about altering the plan, because you're not the first person you're not the first medical professional I've heard say this isn't working the way that we're treating. So what verbally do we say to say we need smaller volume, we would like to request smaller volume decrease the volume setting, is there somewhere that they can go to say, hey, maybe you should look at this doctor's work, they seem to be having success? How do we direct that once that train starts? They just don't know how to stop the standard of care that is currently acceptable for COVID.
Great, great, great. Thanks for that comment. That's a key point. Very briefly, one, you got to realize once you're in the hospital, there is a limitation. You know, we all know that. That's why we want to try to do what we can to avoid it in the first place. That's why we first and foremost talk about prevention. So that's the key component, that not even being getting in that situation. But given that situation, when they're in the hospital before their health degenerates, I would share some of the key points that we shared today, about nasal breathing. This is what I've done. I have friends and family who have been in the hospital, and I have a conversation. Hey, focused on, these are things that anyone can do, regardless of what institution they're in. They have control over decreasing their breathing, relaxing their breathing, nasal breathing in and out, laying on their chest, at times, or sleeping that way to help, especially at night, decreasing the breathing and helping some control. So these are things that I would share with them before they get to that point. But once they're, on a ventilator, they're really being managed by the doctor. And one thing that you can do on the breathing website, breathingcenter.com, if you click on COVID, there is an article by Dr. Novogilov, who wrote about the damaging effects of ventilator management. That's something that you can give to them. And once again, it's not a guarantee, but at least it provides, they are hearing from a doctor, and it may be trigger something for them, because oftentimes if you tell them, they look at you as a very lay person, even if you have, some of the results. Even myself, when I talk to doctors, I have to fashion it in a way, in the language that they can understand, right? So I don't talk about hyperventilation. I talk more about decreasing the pressure, terms like permissive hypercapnia, terms like decreasing the PEEP. These are things that are within their scope that they all readily accept. But if I start speaking about, hyperventilation and whatever, their view of hyperventilation is entirely different than the view of Dr. Buteyko as far as the application of it. So I understand, being on both sides, why they would have a conniption if you talk about hyperventilation and how it relates to health. And they literally will look at you as, you don't know what you're talking about. I understand, because I'm on both sides of the fence. So that's what I do. I try to fashion my words and things in ways that they already understand, but also provide some literature from someone that maybe in their eyes they'll look at as more credible to help support what you're trying to convey. That would be the best case scenario, and hopefully, prayerfully, you're in an institution where doctors are more open to that, and cookie cutter, hey, we've done this way, and a study that we look at how to manage RDS from 20 years ago, even though it's not working, they're still gonna go that route. Hopefully you're not dealing with that type of medical doctor, whereas they're more open, or looking for, because what they're because what they're doing is not working, they're will be open to alternatives or consider some things. That's my best how to best address that. Does that help?
Yes, thank you.
Okay.
And
You're
kind
welcome.
of what I was thinking. And
yes. Who's?
Linda. It's Linda.
Okay.
Yeah.
Okay. Go ahead. Shoot. And then next we'll go to Tight, and then Raven. Reuven? I'm sorry if I don't pronounce it correctly. English is just my first language. I don't know. Go ahead, Linda.
All right. 2 questions. I haven't heard you talk about sleep
Yes.
so much, but sleep's really important in my life.
Mm.
And I spoke with a nurse who teaches Buteyko in Dublin, Ireland.
Sure.
She says, I never had asthma. I also have asthma. She said, but I studied Buteyko because my rounds are changed a lot and my sleep was really wrecked. And so that's one question is, I never knew that you could take Buteyko just to change your sleep.
Mm.
The other part is asthma medications have been very harsh on me, and I was advised for years to take asthma medications just before I go to bed so that I nip a nocturnal asthma attack. Here's what happened. It messed up my deep restorative sleep pattern.
Yes.
And it's still not corrected, and I still have asthma, but here I am hoping that I can learn more and maybe get the training I've always wanted.
Right. Absolutely. Well, great. Thanks for bringing that to the table. And you're absolutely right. It has a significant impact on sleep. In fact, I don't have asthma, but one of the reasons why I pursued becoming a specialist, in addition to my background, is because that's the one thing that it helped for me. It helped significantly improve my sleep, where now I'm able to get more rested sleep, more efficient sleep in less time. So it pretty much knocked off about 2 hours for my sleeping pattern, where I get up, not with an alarm clock, I get up naturally, but really 2 hours less than I used to. I used to be a 7-hour type of person. Now I'm a 5-hour type of person as a result of my training. And that's the one thing that for me, it had a significant impact. And that is the very thing, my sleep. It's more efficient, more effective, and less. And so I'm able to do more. And so it pays off in multiple levels, multiple dividends, when you really start to learn how to address your breathing and get the information that you do. Not only when you don't have symptoms, but in your case as well, it will significantly help your sleeping as well as your asthma. Those are our #1 patients that notice the most immediate improvement, those who have sleeping issues and those who have asthma. But with yourself, I would highly recommend is to do the level 1 training, so that way we can really work with you closely, because it does take detailed work, and it will be well worth the time as well as the finances that you put into it.
Okay. Can you hear me?
Okay. Go ahead, Julia. Yes.
Yes, I just want to tell you that I signed up this morning, so I'm going to be taking the training with you.
Wonderful. I'm looking forward to it.
Yeah,
Thank you.
I had so many things that I think that this is what I'm looking for that will help me. So,
excellent.
Okay.
Looking forward. Thank you so much, and thank you for your support. I'm looking forward to helping you.
Okay.
This is things that I'm really passionate about. Excellent. Now we have Amin.
Hi, yeah, Armine, thanks for the presentation.
You're welcome.
I have a question. It's not just COVID related, but the cough, that spasmic cough that I haven't yet figured out. Is it due to allergies when it's outside or dusty, or food? I'm not sure. But then the cough attack comes. And I was wondering if Buteyko has a suggestion when the cough, like I was biking the other day with my kids, my husband, and it noticed dust around me, and I started, like, it got so scary, tense, and couldn't stop the cough. So is Buteyko, does he have an emergency response to it?
Okay. Well, one of the things, is that we don't treat a specific, when we talk about asthma, or we don't really we're not medical doctors, so we don't treat these things. What we do is we provide you the information and provide the training and exercises to help you maximize your own health so your body can address its own health challenges. With that said, it doesn't matter what the cough is from. If your overall system is much more improved, the principle is it will address whatever, whether it's allergies or what have you. In this method, we have found that, believe it or not, and once again, that's oftentimes what stops a person from moving forward. It's their own belief system, right? Because they've been told that, say they're not going to be able to improve if they have, say, sleep apnea. You know, maybe they've been told by their doctor they're dependent on their sleep apnea machine, or that they're allergic to cats and they can never expect any improvement. Because you've been bombarded with that information, oftentimes that stops people from doing anything. But we're here to tell you that we have folks who have experienced even changing their allergies. And it doesn't matter whether it's food allergies, allergic to cats. There are people who, when applying these principles, the same principles, whether we're addressing, you know, asthma and wheezing, to people who have allergies to various things, once you get your level up and your control pause up, we talk about that in the training. There have been people who have been allergic to cats for their entire lives. And then all of a sudden they can be around cats and not react. So this is the things when we say breathing has a significant impact on one's health, we really mean it has the potential of having a significant impact, but you will only know until you push past your belief system and try these things and apply these things. And so this is why we're offering various levels, so that way, depending on your budget, depending on your time, and depending on really your belief system, you can utilize the Buteyko method and learn the Buteyko method at your comfort level. And so that's why we wanted to not only have this session, but also offer 3 different options for you to be able to get the information that you need. And maybe you start with the test and then go from there. Or maybe you start with the Buteyko map, or reading the book, getting a little understanding, grasping what you do know, applying some principles. If that's where you budget-wise that you're able to handle, then we go there. But the best case scenario to get the quickest results and maximize the results is the level 1 training. Positioned in our section, you'll be able to ask your question. So I don't mean physically raising your hand, but raising your hand through clicking participation, and then that would be the best way. Anyone else have a question? Okay, we have Sherry. I will unmute you. Okay, Sherry.
Yes, hi. I wanted to say that I can say I've already started doing a lot of what you've been advocating, namely nasal breathing, and been doing this for a while, even before I joined your session.
Sure.
And I noticed right away that I was not breathing through my nose like I should. And once I became aware of that, I fixed that pretty much for waking hours. And I felt much better and had more energy, etc.
Sure.
And then I started addressing my night sleep, because I have a mild case of sleep apnea.
Right.
By doing what I learned in Sasha's book, Breathe to Heal, to tape my mouth, which was hard to get my mind around.
Right.
And
Right.
actually do it. And boy, that really helped. And at night, taping the mouth.
Yes.
How bizarre can you be? You feel like, wow, this is really going off the deep end. But I really found that really helped.
Sure.
I've only done that for a few nights, but
Mm.
so far. So I just thought for people who are wondering, you can start doing these simple things and you'll see right away that it does affect you.
Sure.
So,
And you,
sorry.
go ahead. I didn't mean
Well,
to.
and the other thing is in this map for life, and I already bought it actually this morning without the bundle. And does that help much with apnea particularly, or does it address more that problem?
So great question. So everything that you teach at whatever level will be helpful. The issue is that whatever the way to maximize and get the quickest benefits is to have that one-on-one personal instruction, because unfortunately what I've found is that you can read some information and apply it, but a lot of times you will apply it in a way that may not maximize the benefits.
Yes.
But something is better than nothing, as you already have demonstrated. Just by applying some of the principles, you get some of the benefit. But when I work with individuals individually, I'm just sharing is that's when you can really dial down and see specifically how you're applying it, and then share with you, okay, give you the confirmation, yes, that's the way, or there's some slight adjustments that can be made. And so that's the key difference between the map or a book, is that it's really important. And with your breathing, subtle differences can make a significant impact. So,
well,
be mindful.
I have not bought the whole package yet, because actually I've been to over 100 doctors, maybe, I don't know, 120. I went to the Mayo Clinic for 14 days. When I initially got sick with sleep apnea, I thought, I'm not going to live with this. And so I talked to all kinds of doctors and paid all kinds of money to see. They had I started back in 2008. They had no suggestion and nothing that helped. I went on the CPAP. That was like terrible, forcing air down your throat. It did help, but the price you had to pay to wear a mask and have air forced down your throat and look like and feel like Darth Vader was not quite what I wanted to do for the rest of my life. So really, up until finding out about your Buteyko method, I've helped by exercising my whole self. I did that for the last, I don't know how many years. But this is the only thing that I found that did anything to help me.
Excellent. Yes.
Diet, I have nothing too crazy, but just no gluten, for instance, and not heavyweight. I exercise very nicely at a senior center, and that helps. But the doctors helps, and they're not really that interested in helping.
Okay. Well, I appreciate what you shared, and that is true. And in the sessions, continue to learn what you need to learn, and you brought some excellent things. These are little things, in addition to, like I said, our time is so limited, but we tried to pack it out, provide what you can utilize now, and in the information, it will continue to provide, to give you some additional points. So continue pursuing your health and this journey.
Hey guys, how you doing? It's Fred again. And we just finished a 2-day seminar going over some principles and precepts related to COVID-19. We talked about how to prevent from getting COVID-19 or being affected by the symptoms. We also talked about how to quicken your recovery if you did find yourself, unfortunately, contracting COVID-19. And we also provided some information and details that would be helpful to your friends, your family, your loved ones. Whether they attended the seminar or not, you can pass this information on to them, because it can definitely help them, prevent them from having to have an unfortunate experience of going to the hospital. Or even if they were in the hospital, we covered some things that you can pass on to them that could be helpful in quickening their recovery time and getting discharged. But remember, that was really the tip of the iceberg. We really want to help you further understand how to improve and maximize your health. And so the next step would be to go to the breathingcenter.com and plug into some of the materials that we have on the website, whether it be free articles or books that you can download or purchase, video courses such as like this, and one-on-one counseling. See, because we want to make sure that you have the information, but more importantly, we want to make sure you know how to apply it safely and correctly. So reach out to us if we can help in any way. And let's continue this community of knowledge, of sharing, so that we all can improve on our health, the health of our loved ones, and additionally, create a life that can maximize our benefits, maximize our ability to enjoy life, love life, as we all breathe safely, healthy, and slowly. So with that, I wish you all the best. Continue nasal breathing, continue applying the principles that we spoke about. Until next time, bye for now.